So in order for me to talk a little bit about our financial picture of where we are now, I'd like to harken back to where we were in 21, right? In the early precipice of the recovery from the pandemic. And in 21, I would say that the average hospital margin was probably sitting at about 3.5%. On the operating margin side, and we saw ourselves as essentially being in a space of like all clear in terms of signals of coming out of the full pandemic recovery. And what that necessarily meant was, even at that time, so much of our labor costs were tied to the operating budget. So about, I think, 57.6% of full operating margins were pretty much isolated to paying for salaries and beneficiaries. But at the same time, the average hospital had about 326 days of cash on hand. The 2021 picture was driven probably by three things. For one, obviously we had a lot of persistence in governance relief and economic stimulus. I think number two, because of that stimulus, we had the opportunity to drive new innovations like investments in certain spaces and got additional cash on hand from investment income. And then third, so much of our growth in the rate of return, particularly around elective cases, outpaced what we're seeing today with inflation. Now, for that reason, I think 2022 felt like a big halt and a surprise to a lot of organizations out there. 53%, I want us to hold that number in our head. 53% of hospitals in the United States today are projected to have a negative operating margin by the end of the year. I don't know any other time in our recent history where the economic or financial picture has looked that challenging, right? And when we even think about that, so much of that is due to the rising costs of labor and supply. In fact, since 21, on the labor side, that has increased 29%. And on the supply side, that has increased at, 19%. So for a lot of health systems today, I think that equates to the change from that pre-pandemic operating margin of 3.5% to by the end of the year, we are all projected to be sitting on average at 0.2%. Let's fast forward into 23. What happens in 23? Well, for one, we're clearly seeing inflation do what it does, and that will continue to be challenging. Our labor costs are going to continue to outpace inflation. And if I were to even bring one more challenge with the election around the corner, we have mandatory cuts coming out of the pay-go sequestration in 23 that without an act of Congress is going to only further contribute to that financial picture. So a lot of data sources right now and analyses are projecting that by the end of 2023, the average hospital is sitting at margins of negative 1.7% to negative 3.3%. If there's no other urgency lever for what Pranay was talking about a little bit here on transformation, I'm not quite sure what it would be.
Wow, is there any good news?
Of course. I mean, I think there's a lot of good news. I think particularly in the last 2 years, so much of the good news is also what our challenges lie. Mm-hmm. And it speaks to our workforce. Mm-hmm. The thing that a lot of the folks in this room do better than any other disruptive innovator out there, and we all know that there are plenty coming to cream skim patients or consumers from us from the top, is clinical care delivery, right? Is thinking specifically about owning and managing that patient relationship. And that is where I think increasingly the sweet spot will lie.
Mm-hmm. As you convene executives all the time, I'd love to, step back from the data. What's the response you're hearing to this? What are you hearing chief executives, chief operating officers, chief informatics officers, and digital officers talk about today?
Yeah.
What are they concerned with?
Yeah, so it's not a surprise, right? Workforce is so much of the challenges or the concern of the day, but I think there's actually nuance in that conversation. Mm-hmm. So I think for one of the things I would point to is whereas we are not yet back to the workforce we had pre-pandemic, so much of that is due to challenges with like hiring staff. In fact, we were talking at lunch, and I was spending some time with a couple of CIOs who were talking about just how many more openings they have today compared to a year ago. So how do we do a better job of taking what we do really well and uniquely and compete for staff? And then secondly, think differently across the board that when we think about labor, I hate to say it this way, but I'm going to, not all labor is equal. Mm-hmm. So there's a difference between how we think about our enterprise from a clinical perspective and a non-clinical perspective, and therefore the strategies need to look different. So for a lot of leading health systems we work with today, I think on the clinical side, they are doubling down on, obviously, how do we invest in the right type of resources, sometimes that's technology and sometimes that's not, to bring value back to our providers, to help them operate more efficiently at scale, and more, frankly, to reduce some of the burnout, right, or residents that we're seeing. On the non-clinical side, especially for a lot of the systems my organization works with, they cover multiple geographies across multiple states. And for any region, you're probably talking about a very different optimal amount of managerial and leadership teams. So I think in that place of the strategy, we're thinking about how best do we better streamline our non-clinical workforce. More specifically, identifying efficiencies if we were to change the workflow that we might, through attrition, either reduce or eliminate certain roles. How do we outsource to different companies for oftentimes back office or IT functionality? Or even in the case of how do we streamline reporting relationships and overall top-tier management so that we're looking at less distributed responsibilities and more centralized operational rigor.
Mm-hmm. All great insights. Gosh, I don't even know where to continue. What do you think? I'd love to get a sense from you on, what do you think healthcare has gotten wrong so far about digital transformation?
Oh, man. So I see one of my colleagues in the room, and I'm going to not call him out, but we were just together last week having this conversation a little bit about when we think about digital transformation and what we need to do specifically to do a better job of responding to our consumers. I'm going to coin a CEO who is not in the room, but he calls it the great patient disconnect. And I find that such a powerful phrase because, for one, what he likes to talk to me about in this great patient disconnect is there's a difference between what we as providers, and yes, I'm coining myself as a provider today, but what we as providers want, which is patients to be engaged, right? Patient engagement is a term we've been using for a decade to mean so many different things. Whereas what patients or consumers want is success. A successful experience, a successful outcome. And how best do we bring those two things together? And so much of that first relies on, before we move digitally, there's so much standardization that needs to happen in our workflows. And I'll give you one quick example of that before I talk about a couple of the other things. But on the workflow side, there was a health system that went through, man, how do I leverage automation and AI to think differently about my supply closets in the unit? We can't hire enough of the nursing assistant staff to make sure those things are up to code and up to scale. Frankly, it exhausts our bedside nurses and nurses' assistants. And this is a great area where we can bring a robot, bring an automation solution to do it. But pretty quickly, they realized when they looked at one supply closet in any given unit, it was one supply closet. Let alone if they looked at it across all units, across all hospitals. So how do you create an automated standard process when we don't even have that standardization there? I think the second thing is specifically around change management. So whether it comes to rolling out a digital solution for an optimized workflow, if we don't culturally, through governance, as well, bring our organization along through change management, so many of our clinicians, if I'm being honest, might be at the front door of saying, no, we can't power through. So great example there was an organization who was trying to roll out an automation scheduling system in their OR, just to improve overall OR efficiency. And they had done all of the work. They were able to project a major ROI within 1 year of saving, we're talking in the maybe $100 million range. And their biggest detractor to moving forward were their surgeons, who did not want to change the way they have typically always done block scheduling. And no one thought to bring the surgeons along very much in the beginning. So that's that change management aspect. And I think last, but certainly not least, I would just think a little bit more about how are we thinking about creating the frictionless experience. So much of our work has been focused on, we have spent so many of our dollars in the EHR and EMR. We need to optimize and get as much utilization out of that as possible. And still, for a lot of you, we are focused on not only interoperability within our organization, but interoperability across a number of point solutions. We haven't yet even talked about what does interoperability get us if our patients and our providers don't find those things easy to use. So how do we design the right processes around the most important end users?
Thank you, Tomi. That was fantastic.
Thank you very much.
Thank you.